So actually, it seems like we might be done a little bit earlier. The next thing is like to talk about symptom inventories. Those are not projectives. We're done with projectives. This, in the core concept list, comes more in the section of objective tests. But because I knew that there wouldn't be that much to say, or the projective part wouldn't take the whole time, I decided to include this here. So there are some that you're probably really familiar with, others that you don't, and you probably don't have to, for the comps. There are tons of symptom inventories. And pretty much for every single disorder or condition that you could possibly imagine, one exists or is being made. So I'm familiar with a lot of like trauma inventories, and like a lot of people that have like trauma symptom inventory, trauma symptom checklist for children, trauma symptom checklist for young children, UCLA PTSD index. Anyway, a lot of, like, there's just tons and tons and tons, and it's completely, we can't go over all of them. So we'll just go over the ones that I know for a fact you need to know. So essentially what they do is they assess for very specific symptoms. So they can be used, and they tend to be fairly brief. And it's from 5 to maybe up to 15 or 20 minutes, depending on which one. So they tend to assess for very specific symptoms, and they're used as screeners for a condition. Say let's see if you're depressed, and you give them to them. There are two types of symptom inventories. One of them is a self-report, like most of the ones that you're probably familiar with, where you give them a sheet of paper and it says, well, here's a list of symptoms that many people have. Please rate using this Likert scale, how you feel, or if you've had these symptoms over the past 2 weeks. Usually there's a very specific temporal criteria, and then they do it on their own. There are also some clinician report inventories, which are very similar, except it's not based on what the person endorses, but rather you do a clinical interview, or you do a semi-structured interview, and then the clinician gives the ratings based on the responses. So it's a little bit more like a briefer, more focused version of something like the structured clinical interview for DSM, which is not a brief symptom inventory, but it's kind of like a symptom inventory. You go through something and you're like, well, have you felt this? Okay, and then you go and ask very specific questions. An example of a brief symptom, I don't want to say brief symptom inventory, but a brief inventory of symptoms, could be something like the Hamilton Depression Index. Questions? So these are the ones that, I'll talk about some of these, but in general, some symptom inventories are for sort of more general symptoms. And one that's very, I think one of the ones that's mostly used is the Symptom Checklist 90 Revised. We'll talk about that one in depth. There's also the BSI, which is the Brief Symptom Inventory. And as I talked, it's there's a structured clinical interview for DSM-4. So the SCID 4, we're not going to talk about that one. It takes a lot of training to do, apparently. I don't know it, but it's not something you have to know. The ones that are in bold are the ones that I'll talk about a lot more. So these deal with I want to see what symptoms you have in general. I'm not so sure, so I'm going to give you something very broad. Or they're the very specific ones, such as the Beck Depression Inventory, which it says is only for depression symptoms. Or the Beck Anxiety Inventory, State Trait Anxiety Inventory, Connors. Talked about the Hamilton Depression Inventory, which is very specific. It's a clinician self-report. And then there's the SADS, which I sometimes feel like they should come up with better acronyms. The SADS is a clinician, it's a clinician rating, and it's the Schedule of Affective Disorders in Schizophrenia. That one comes up a lot in the research, not so much in clinical practice. So we'll talk about some of these, the ones that you have to know a little bit more about. Symptom Checklist 90, so SCL90R, called SCL90 because it has 90 different symptoms. They're all on a 5-point Likert scale, ranging from 0 being not at all or 4 being extremely. Usually takes between 12 and 15 minutes. And this is something that, for instance, a lot of therapists, especially people that are more CBT-oriented, will give this to every client that arrives to the first session as a way of looking at, like, okay, let's see how you're doing generally. Another one that's used... the other thing that they're used for a lot is, you give them at the beginning of therapy, somewhere in the middle, and then at the end, and you see, well, have the symptoms subsided? And again, that's a very CBT type construct, but it's used a lot for that. Another one that, like in my practicum, we use the OQ45, the Outcome Questionnaire 45. 45 questions, very simple, Likert scale. These are things that some people feel. Let me know how you feel about these. The SCL90R is nice in that it has 4 different sets of norms, because, I mean, you're not going to compare somebody that's in an inpatient ward to somebody that has no psychiatric problems, because it's not really realistic. And so it has the set of norms A for psychiatric outpatients, B for non-patients, C for psychiatric inpatients, and E for non-patient adolescents. And a really mean question of the comps would be to talk about the set of norms like that are D, but I don't know why they don't have those. Maybe the people that made this didn't know the alphabet. I can't help but wonder. So the Symptom Checklist 90, it can be a little lengthy, especially if you want to use it a lot. Some clinicians use checklists like these at the beginning of every session to track progress. But if you're going to, this one takes a little bit too long, so there's an abbreviated version that has only 53 items. It has very similar validity, very similar reliability. It just takes longer. So both for the SCL90R as well as for the BSI, there are certain global indices. I don't know how likely it is that you have to know this in this much detail. I guess it's fair game. Both of them are measured in terms of T-scores. So if you don't know what this means at this point, you should really start studying a lot harder than you have. T-scores have a mean of 50 and a standard deviation of 10. They're used in the MMPI and a bunch of different measures. The Global Severity Index is the best indicator of distress. So if you want to see somebody, how somebody's presentation is, that's the first thing you want to look at. It has to do with the intensity as well as the number of symptoms endorsed. So it matters if they endorse a symptom mildly versus extremely, but it also takes a look at how many symptoms are endorsed. Research has shown that a T-score of over 63 means that the symptoms are clinically significant. T-score of 63 is slightly over 1 standard deviation above the mean. Another one is a Positive Symptom Distress Index, or PSDI. That is the average rating of all items endorsed. So it's really, it doesn't matter what type it is, it doesn't matter how many they have, you just do an average. So it's how, without concern about what the symptoms specifically are, how intense are they feeling their symptoms. The last global index is the Positive Symptom Total, which is the number of endorsed symptoms. So that means that how many of these questions, 90 or 53, depending on which one you have, that they endorse having to any degree. So people that are, people that have a lot of problems, but they're very high functioning will still score very high here, because it's about the number of symptoms endorsed without concern about the severity. So those are just global indices that can give a general idea about what the person's doing. But really what you want to do then is look at, hey, what type of problems are they having? And it has different symptom dimensions. These are sort of the scales. It measures somatization, so things about body problems that might be real or not. Well, they're always real, right? But they might be there might be medical reasons for it, or they might have psychological reasons for it. There's an obsessive-compulsive dimension, interpersonal sensitivity dimension. That's actually really interesting with somebody that doesn't have very clear psychopathology, but they have a lot of interpersonal problems, or like Axis 2 type stuff. IS is probably going to be high. There's the depression and anxiety, hostility, phobic anxiety, paranoid ideation, and psychoticism. As you can see, a lot of these will overlap with the MMPI content scales. So, I mean, giving both of them might be a little redundant, but usually the SCL-90 is given when you want just a brief clinical picture of somebody, and you don't want to go necessarily as in-depth as to give a full MMPI. Mm-hmm.
What's the age range?
Actually not sure about that, the age range.
I'll look it up.
We'll look it up and let you know. Usually these are for like adolescents and adults. Okay, so the Beck Depression Inventory 2 is probably the one that you're more familiar with. Just 21 items. It takes like 5 to 10 minutes to complete. People that are really, really depressed are probably going to take a little bit longer. Usually people do it in 5 minutes. It has 22 items related to symptoms of depression. Something that is useful about it is that it doesn't... It actually goes pretty closely by the DSM. Although if you know your DSM criteria for depression, there are 9 total possible symptoms that can be endorsed. But are there 21 items? Well, some of the DSM symptoms can be ranked as either high or low. So for instance, problems with appetite. You can have gained weight, and that's a symptom of depression, or lost weight. So what the Beck Depression Inventory does is it actually kind of splits them up. So one question would be like, actually no, not for that one. But in general, for some of those things, like, do you have a lot of energy? And another item will be like, do you have very little energy? Which DSM criteria-wise, it's only the same. Mm-hmm. Do you have any for the BSI?
For BSI or for SCL?
Or the SCL, the 90?
They have norms for adolescents 13 to 17, and then adult norms 18 and above.
Okay.
Thank you.
The norms for adolescents are only non-patients, though?
Just Google that?
Yeah.
I thought you might have some, like, assessment app or something.
Something that is really useful for looking at these, especially the ones that you don't have to know a lot in detail, is to go to the developer website. And when I'm done here, I can show you. There's a spreadsheet that's available to you that has links to all the developer websites for all these tests, and they have everything you need to know because they're trying to sell it to you. So that's actually a very useful resource as you study. The Beck Depression Inventory is the one of all the depression inventories, the one that is most closely linked to the DSM. But at the same time, it goes beyond the DSM. So it asks for stuff like sexual dysfunction problems or dissatisfaction with sex, which is not a DSM criteria, although some people say it should be. But it's there anyway. 4-point Likert scale from 0 to 4. Actually, that's a 5-point Likert scale. No, it's from 0 to 4, so it should be...
Yeah, 5-point.
It's a 5-point Likert scale. Something that's different about the BDI and the BAI and a lot of others is that there are no norms. So you're not comparing a person to the general population in the same way that we do. Like normally for other tests, you get like in theory, a beautiful normal distribution that can be analyzed with inferential statistics, what we all love to do, and we say this person has more symptoms than 63% of the population. And that reflects something. Here, it's based on cutoffs. So saying, usually based on the normative sample, people that have anywhere from 0 to 13 have minimal depression, 14 to 19 is mild depression, 20 to 28 is moderate depression, and 29 to 63 is severe depression. So it's they plotted people out, they compared it to clinical samples, and they said, this is what captures best in terms of the people. And I would probably try to remember sort of these norms. Probably not all that important. Scores under 5 can usually suggest a denial of symptoms or faking good. Again, these are very, very clear what they're asking for. Do you often feel sad all day for most of the day, almost every day for the past 2 weeks? Yes or no, and to what degree? Like, not very clear what they're asking for. Right. Most people have some symptoms. Nobody's super happy all the time, unless you're maybe manic, in which case that's a different problem. I would be hard-pressed to say that everyone here has had no problem sleeping over the past 2 weeks, ever. So scores under 5 can indicate response things. If that comes up, you might want to go back and look at MMPI validity scales, for instance. Are they being defensive? Is this something about depression, or is it something about their general response strategy? The Beck Anxiety Inventory I find really annoying because it has different cutoff scores than the BDI. Also, it's sensitive to physiological anxiety, not so much to worries and like rumination. It's a 4-point Likert scale. Takes 5 to 10 minutes, and it has cutoff scores. I feel very tense. I have panic attacks. Well, probably not, but it's that sort of like physiological anxiety that it looks for. Instead, I personally like the state trait anxiety inventory a lot better because it's more sensitive to more subjective anxiety, worries, ruminations, stress about taking the comps, or whatever else, like assessment reports or brain dysfunction. It has 2 sides. One of them measures trait anxiety. One of them measures state anxiety. And they're almost the same types of questions. One of them just, the prompt says, how do you feel right now, versus how do you generally feel? 4-point Likert scale. Some of the items are reversed. There's a version for children. The norms are slightly confusing, but they're standardized scores, so it's comparisons with the normative population. And there are different sets of norms. There are some for adolescents, some for adults, there are some for military personnel. Probably won't see a question about this one. Oh, I like it. Oh, look at that. Well, that's all I have. Is there another one that I didn't talk about? So I'll briefly just talk about some of the Connors I didn't talk about, because I talked about that when in the session about the WACE and cognitive testing. The Connors is right now we're at Connors 3. There are versions for the parents, for the children, as well as parents, children, teachers. It's really seen as the standard self-report or report inventory for ADHD. Connors 3 goes a little bit beyond just ADHD and also talks about oppositional defiant versus conduct disorder, just because ADHD and those externalizing disorders tend to go at the same time. And another symptom inventory that is used for children, but I think that Zoe went over that last week when she talked about objective tests, is the CBCL. So that's another one that could fit into this. I'm not talking about it because we chose to include that in the different review session. Are there any questions about this or anything else that I've talked about? Okay, so I'm going to show you, we still have like a few more minutes. I talked about briefly, like, there's just a lot of these tests that are out there. Some that you need to know, some that you don't as much. But like, I think it's useful to know about this. But I'm going to show you I've been talking about like Moodle, where I've put a lot of the resources. I'm going to show you where those are, and maybe a little bit about the resources that I have included in my portion. And if you look at that later, it's probably I'm going to put some practice questions for the comps that I developed. So if you go to Moodle, so elearning.alliant.edu, what is this? All right. And you should all have it, but maybe not. And if not, you can just enroll in this course. But it says cross-campus graduate tutorial services and academic support brought to you by the San Francisco campus. Dr. Patel is the teacher for that. If you click on that, there's essentially, that's all the tutoring services. So you can make an appointment to see me, the other assessment tutor, or any of the other tutors. And so if you go to the very bottom, that's Zoe being very badass. But she has, an awesome summary of the Rorschach. She might put other stuff in there. These are the reviews that things that I've been developed as reviews, both for this and just for in general. This sort of is a schematic about how different tests are divided. Achievement tests is just sort of a summary of all the different subtests and what they are. And then these three are the reviews that I've, or at least the part for my part of the MPI review, and the one about COG and educational assessment, including the Connors. This is today's slideshow. And two things. Here there's a website that I found very, very, very useful. And I'm going over this now because we probably won't have time to go over this next week because there's so much about the Rorschach.
Is it next week or 2 weeks from?
2 weeks from now, sorry.
And the whole session will be devoted to the Rorschach?
Yes, just the Rorschach.
Okay. And we can go over the 4 hours if necessary.
I mean, it'll still be probably just those 3 hours, but there's plenty of stuff, and we want to make it a little more interactive because we know you all have done the Rorschach, so we'll go over a little bit about the theory, but then work through some examples. But so this is the link from my tutoring website. It's kind of amazing. It's not super up to date. This is from some university somewhere. I don't know what it is. Based on what I know, I've been able, it has a lot of stuff. It's not super up to date. Like, for instance, here, the PPVT, there's a 4th edition, which is not shown here. But so let's talk about, for instance, we talked about the Rotter, the RISV today. So it's just like this gigantic list of a bunch of different different assessments of every different type. So let's see if we do click on the one for the RISV, for instance, because we talked about that today. It's just a very brief summary of what it is, who publishes it, what the populations are, what the purpose is, how long it takes, and just a brief description of it, how you score it, and just brief things about the reliability and the validity for it. What the norms are. Again, this is probably just a RISV for college students, so it's actually I would recommend that you don't just go based off this, but if there's a test and you just want a brief snapshot, this is a good place to, booklet category test. So let's just look at another one just to show you what type of information is maybe one of the more elaborate ones. Like house to be person, most things are there. the MCMI, for instance. Again, purpose, what the scales are. And again, like, it doesn't take 25 minutes. It takes kind of a little bit more. But in general, it tends to be fairly accurate in terms of what the scales are, what the description is. So if you want to just look at, for instance, like, you should know about the PPVT, and if you don't really want to go a lot into that, this is just a good place to go. Another good place to know about tests in general is this. It says test to know is the name of the file. Here it says test to be aware of. It doesn't make much of a difference. And that is more specific to the type of stuff that you need to know for the comps. And it is just a... That's not it. That's it. It's a spreadsheet that I created to help you study with essentially all the tests that are mentioned or alluded to in the core concept summary. Abbreviation, full name, what it's supposed to do, so like based on categories, age range, if there are any other versions that I didn't think would be different enough to merit a different line. So for instance, for the Connors 3, like there's a parent form, a teacher form, a youth form, and there are also short and long forms. Things like that. Or like for the WAIS, I included here the WAIS NI, which is the WAIS as a neuropsychological instrument. Just know that they're there. Any notes that I couldn't get out of my head when I was looking at this? And then I have this, which is a link to the publisher website. So for instance, let's go to the... I don't know why I can't click on this. Undo. That's odd. Anyway, so like for instance, here, I thought you could click on it and go straight to it. But I found this really useful in studying because I was like, I'm not going to be able to look through every single test that I feel like I should know. So I would go to the... Ooh, that's a Stanford Binet. Well, that's as good as any. So like the Stanford Binet, I knew that it wasn't going to be a huge emphasis on it. There are certain things that I needed to know. And again, it's the publisher's website. It's kind of accurate because they're trying to sell it to you. And it just has a lot of very useful information that about the test, how it's split up, the rationale behind it, why would you use it, what are the norms, if there are any alternate forms. So for a lot of the things that if you don't need to know it in full detail, or you're running out of time, you can click on the developer's website. I find that to be really useful. And then here, this is, if you go through this list and you say, oh, I know all of these, then you're in good shape. There's like 52 of them. A lot of them you probably already know. Some of them you don't actually have to know all that much. Like, for instance, these two, the GORT and the TOWEL, they are used for educational assessment. Probably just knowing that they're there and what they are. Like the GORT is an oral reading test, so it's about reading, and the TOWEL is about written language. And that's misspelled. That's probably all you need to know. The reason to know a lot of these random tests is because there might be questions where they say, well, if you want to assess a child with learning disabilities, which of these tests would you consider giving? And there might be tests like the... Actually, no, that's... they'll say, like, well, if you want to diagnose mental retardation, what test would you give? And you'll have WAIS, or WISC, GORT for Vineland, A and B, A and C. those are the 5 responses. Well, you would need to, like, if you don't know that the Gord is an oral reading skill, then you might not know that if you could use that for mental retardation or not. And you need to know, oh, the Vineland is adaptive functioning, and you do need that for mental retardation. That's one of the type of, like, more tricky things. Like, you would use the Waze, but you would also use the Vineland. And if you have some of these other more, well, let's just say less emphasized tests, then, like, it's going to trick you. Like, it's going to be more confusing. So a lot of these, like the Gordon Towel, for instance, are there just for recognition type of thing. Just know what they do, and that's probably good enough. Not like the age range or whatever. And the ones that are in bold are the ones that you have to know in and out and in again. So like the TAT, the Rorschach. Milan, you need clinical working knowledge. MMPI, you need to know in, out, and upside down. Vineland, you probably don't. These achievement tests. And like the WACE and the WISC, essentially. Okay. So that's all that I have prepared. Are there any questions? I mean, just about this, or just anything in general?
Yeah, something I hadn't thought of too much, but I suppose if you're aware of the test, you're aware of the acronym that the test is used,
Mm-hmm.
or which the test is used. But just generally on the test, when they talk about, I guess, in the multiple choice answer portion, or all the multiple choice, right? But
Mm-hmm.
will they sometimes just use acronyms, full name of the test, interchangeably?
Right, so the question is how much you need to know the acronyms, or how much in the comp questions you'll have to know the acronyms versus the name of the test. You have to know both, right? For a lot of them, they'll just say MCMI, and it'll be assumed that you know what that is.
Okay.
Or they might just say, Milan Clinical Multi-Axial Inventory, and you'll have to know that as well. Any other questions about this, or actually anything else that might come up in your studying, even if it's not about stuff that we've gone over? Well, if anything does come up as you're studying, or you have any questions, feel free to email me. If you go to Moodle and go into the I deleted that. My email is there. At least for me, I don't know about the other assessment tutor. Sort of office hours for assessment tutoring will happen only until I guess like the 16th of May. And then after that, we might still be able to meet with you, but we're not just going to be here hanging around, but it'll be like by appointment only. So I can actually give you the exact date for that is, until the 6th. Mine are going to be until the 16th.
I was looking through the resources,
Mm-hmm.
and I was watching the first video, so I wasn't able to make it to that class. And she has a handout, but I haven't been able to find that handout.
I'll let her know to be able to put that on Google.
So these sessions they're Zoe and I are sort of taking turns going over different topics, and so it's just sort of up to us what we present, so I'm not sure if she's what she's planning to do for that. Okay, well if that's it, I'll hang out for a little bit longer. If you have any questions that you don't want to be videotaped, feel free to come and ask. And if not, again, the last review session is going to be in the Rorschach. Should be interesting and important. And there's just so much about the Rorschach that you need to know that we wanted to devote an entire session to that. So hopefully you'll be able to make it, and we'll be in room 206 in 2 weeks. Great, thanks, and have a great weekend. Enjoy the weather.